my name's Ayla. I'm going to be your student nurse today. You've been ordered an indwelling urinary catheter. Do you have any questions about what that is or what the procedure for it is? No? Okay, great. Can you go ahead and tell me your full name and your date of birth? Awesome. And are you allergic to anything that you know of? Okay, awesome. So for this entire procedure, I'm going to make sure that I keep in mind my general principles and safety practices. And I'm going to make sure that I provide for privacy by pulling that curtain. And I'm going to raise my patient's bed up to a good, comfortable working height for me. And we've already done peri-care here, so we can just jump right into the procedure. So I'm going to make sure that I do my hand hygiene, and then I'm going to set up my sterile field. I've already got all my supplies gathered, so we can just go ahead and jump right in. So I can set up my sterile field here. I'm going to just set up my sterile field directly between my patient's legs. All right. And then, because I've already set up my sterile field, so now I'm going to put on my sterile gloves. Because I don't have anybody to help me film today, I'm going to have to pull my sterile field this way so that if me putting on my sterile gloves are able to be seen. All right, and then I will dispose of that. Make sure I don't lower my hands below my waist. So pull my sterile field back to me. Okay. So now I'm gonna just get my supplies set up. I'm gonna take my lubricant here and just go ahead and put it out onto the tray I have here, which I don't know if you can see the tray. Like that. So I've got my lube right there. I'm gonna go ahead and clean the area. I'm gonna go down one side of the labia, dispose of that. The other side, dispose of that, and directly down the middle. And I'm going to dispose of that. Okay, so now that I've got that set up, I'm going to take my catheter here, and I'm going to dip it in the lubricant, and I'm going to sacrifice my non-dominant hand. It's now going to be the dirty hand. Move over here. See better. And I'm going to spread the labia using my forefinger and thumb, and I lubricated about 1 to 2 inches of the tip of the catheter, and then I'm going to insert the catheter until I see urine return, and then after I see that urine return, I'm going to insert it about another 2 to 3 inches. And then I'm going to stabilize the catheter with my non-dominant dirty hand. I'm going to inflate my balloon. And I'm going to check here, see if I can, if I have some retention, and I do. So that's good. And I'm going to go ahead and remove my syringe there. And now that the balloon is holding the catheter in place, I can go ahead and remove my gloves. I'm going to do some quick hand hygiene and put on a new clean pair of gloves. So I'm going to make sure that I stabilize this to my patient's leg. If they have legs, you stabilize it to their legs. And I'm going to place the drainage bag below the bladder. So I'm going to place that below the bladder. And if there's ordered a urine sample, I'll go ahead and obtain that now. And then I'm going to clean up my mess and clean up the patient if need be. Check, are you okay? Do you need anything? All right, so I'm going to clean up my mess, provide for comfort, and I'm going to make sure that the bed gets lowered back down before I leave, and I'm going to make sure the call light is within reach, and I'm going to perform hand hygiene. I'm going to go report and record, and then I'm going to come back and evaluate and make sure that the patient's still okay and good.